Tres.
Hi, good morning. How are you? Fine, thanks. Come in, please. What's your name? I'm Ana Carla. Hi, Ana Carla. My name is Dr. Ileana, and what can I do for you today? What brings you here?
I traveled to Africa for like 2 weeks, and I just came back 3 days ago. And I've been feeling like really weird. I thought it was jet lag at the beginning, but I have been like sweaty. I think I have fever. I have a lot of headaches, a lot. And last night I vomited. It was really painful, like 3 or 4 times in the night. And in the morning I went to the bathroom and I saw there was a little bit of blood in my.
Okay. Well, first I'm going to ask you some general questions about, well, your history and stuff, because it's like, things I need to know. What's your complete name?
I'm Ana Carla Naranjo Gonzalez.
Okay. And how old are you?
I'm 23 years old.
Okay. Are you from here? Do you live here?
Yes, I'm from here.
Okay. Well, could you tell me a little bit about your childhood? Did you get very sick very often?
No.
What kind of diseases you had when you were a kid?
I had chickenpox when I was young. I had like the usual kind of diseases, nothing like really.
Cold and stuff.
Yeah, the flu. I have been just one time in the hospital because I got a rhinoplasty, but well, it's like more physical.
Yeah.
And well,
any times you were in the hospital, surgeries, anything?
just a rhinoplasty, and I have had all my vaccines since I travel a lot.
Okay. So let's talk about a little bit your work. You said you traveled. Is that work or was it fun?
No, it's work. I'm in like international relationships, so I have to travel like every 2 months. So it depends. So I travel a lot. I have been to many places in the world, so I have to get all my vaccines so I can get the visa or the passport, etc. And I think it's a really stressful job because it's like you have to be all the time traveling. You're never in a same place, so that creates sort of some conflicts with the family, and it's hard.
Talking about family, are you married?
No, I'm single.
No kids?
No kids. No.
Okay, so a little bit about your family, your mom, dad. Do they have any illnesses that are relevant?
Well, my mom is hypertensive. But she's really normal. She exercises. She works. She's working right now. She just got one surgery when she was younger. She fell off the stairs and she broke the foot and the lower part of the leg. My dad, he's really healthy. I think so. Yes, he's really healthy. My grandpa, he has diabetes. But he's like stable now. He's been controlled. I have 2 brothers and 1 sister. I'm the younger, so I'm like the baby, and they're all fine. My younger sister she just married and she's having a baby like in 6 months.
That's cool. Congratulations.
Thanks.
And tell me a little bit about your lifestyle. Do you exercise? What do you like to eat?
That's a really complicated question since
you travel a lot.
Since I travel a lot, I don't exercise much. Sometimes 1, twice a week is too much. I eat all of kind of food, sometimes junk food since I have to be like really fast to one place and another. But I try to eat normal, healthy.
Well, so tell me a little bit what you did in Africa. What did you eat there? Something that could have been like bad for your stomach?
Well, I went to Africa for my job. So I was sometimes in like a not so nice area. So I ate what they gave me. Really, sometimes I didn't know what it was. But I never felt like really sick of my stomach. It's more like my head. I'm all the time. I'm sweaty right now, and I don't know.
Do you have any allergies?
Yes, I'm allergic to penicillin.
that's a very typical allergy. You may know. Have you had any babies?
No.
No?
No.
Are you planning or anything?
No, right now.
So, because of the medicine that we could give you, it's very important to know if you're planning or anything.
No, right now.
Okay, so I'm gonna have some tests, some physical examination. Do you mind?
No, I'm okay.
Could you please sit here?
Of course.
Do you mind? Check your heart to see if there's anything wrong with it. Everything seems normal. I'm gonna check your blood pressure. I'm gonna need you to turn me around here, please, just a little bit. Could you lend me your left arm, please?
No, sorry. It hurts.
Oh, what happened here?
I actually don't know. I just.
Did you have did you burn or did you have a mosquito bite? What happened? Did this happen in Africa?
Yeah. It's
Oh, okay. Well, that doesn't look good. Okay, I'm gonna check your pressure on the other side. Well, your pressure is a little bit high, but I can think it's because of the headaches and the things you've been having. I'm gonna take your temperature because you said you thought you had fever.
Yes.
You were sweating a lot.
Yes.
So, I'm gonna ask you to put it in your arm for a while. Okay. I'm gonna be checking here. It doesn't look. Did you clean it or did you do anything about it?
Well, I just cleaned it, but like really superficial, so I don't even know what is it.
Okay. I think this is very important to have it checked because it could be something bigger. I'm gonna check a little bit about your stomach because I think you may have something in your stomach or something you ate. Well, it looks like your liver may be a little bit enlarged. We'll have to check that because of why it's happening. Could you give me the thermometer, please?
Yes, sure.
Well, as you said, definitely you're having a fever, and maybe you've been having it for a long time. So we're gonna have to be careful with that because if it goes up even more, it could be very dangerous. So I think I have a diagnosis for you, but I'm gonna have you go get a blood count and some echo on your stomach and all your thorax because I need to know what exactly it is. So I'm gonna have you go to the lab down here and go get the CBC and ask them to have it right away as fast as they can, please. And as you have it, you can come back, please.
Is this serious?
It may be, but if we control it, it doesn't have to be. So this is the reason I need the test very quickly.
Okay.
So if they can happen, I think in tomorrow. By tomorrow, you're gonna have the tests. You have to come with no breakfast and without eating anything.
Okay.
So I think by tomorrow in the morning you could have the test and you can come back, please.
Okay.
Okay.
Well,
See you. But don't worry, everything is fine. Okay. You're okay. Just we have to be sure and we have to take care of you. Okay.
Thank you.
So I'll meet you tomorrow. Okay.
See you
Thank
tomorrow.
you.
Thanks.
Bye. Hi Anna, how are you?
Hi.
I'm glad you're back. How you been?
Fine. Well, not so fine. I think so. Yeah, this is my results.
Okay, thank you. Please sit down.
Oh, thanks.
So, what you say you haven't been good?
I don't know. I think I'm freaking out. I have fever and I'm sweaty and I can sleep. I'm feeling nauseous and I have like chills. I don't know. I think this is going worse than
Relax,
that.
no. Everything is fine. Don't worry. Yeah, as I thought, my diagnosis was correct. I believe you have malaria, and it's not a very serious there are varied degrees of malaria, but as I told you, because of the mosquito bite you had on your arm, it got infected, and it's a dangerous bite, but it's very treatable, and we got it on time. You said you came back 3 days ago.
Yeah.
You were 2 weeks in Africa, and that's exactly the time it takes to start to have an effect on you. So that's why you started feeling it till you came back, and not when you were there. You're a little bit anemic because, well, I can explain you how it works, so you can be like a little bit.
Yes, please.
So, the mosquito bite, it comes into your bloodstream and it goes to your liver. That's the reason your liver is a little bit big. So, because it started reproducing the parasite on your liver, so it started spreading through your blood. And also, you had anemia because of the hemolysis of your red blood cells. It means they are dying. And also, that's why you were urinating on your urine. That's why you had blood on when you went to the bathroom. But don't worry, it's not very serious. Well, also I can see that the low pressure I told you had yesterday, it's due to this because of a cardiac collapse. But don't worry, everything is gonna be fine. We're gonna treat you with something called chloroquine. It's an antibiotic given to people who have malaria. It is completely treatable. You're gonna have a course of antibiotics for 2 weeks. It's a long time, but well, it's the time it takes for the parasite to leave your complete body. And also, I would like to take your temperature again to see if you have any fever. Could you please put the thermometer back in, please?
Yes, of course. And these antibiotics, 2 weeks, and I have to take it in the morning.
You have to take it, well, I'm going to give you the package, but you're going to have to take it twice a day, once in the morning and once before you go to sleep. You cannot miss any of the medicine because we'll have to start over again for 2 weeks because it's like 15 days exactly. But don't worry, everything is going to be perfectly fine. I'm going to have to check your heart rate once more to check if anything is wrong. Well, everything seems to be normal as I told you, only I think your blood pressure is a little low because I told you. Could you give me back the thermometer, please?
Yes, of course.
Well, your fever is a little bit high too, but nothing serious. It's due to the same infection you have. But I'm going to give you some other medicines to reduce the fever. And also, well, the chloroquine I told you. Do you have any doubts, anything? Don't worry, everything is going to be fine. I'm going to be checking on you. You have to come every 5 days.
Okay.
I'm sorry if it's like very early to come back, but it's because we have to see the progress and see if the medicine is working. So, do you have any doubts?
No, I think it's really clear.
Okay. Well, the pharmacy is right here. So you're gonna give them this, and they will give you your medicine. And tell them to give you 2 packs of them.
Okay.
And so you can come back if anything is wrong. You have any doubts, any other symptoms. Please be sure to come back. Okay.
Okay, doctor, thank you very much.
You're gonna be fine, I promise. Okay. Just rest a lot, drink a lot of liquids, and just be easy. Don't stress a lot. Okay.
Okay.
Okay. Thank you very much. See you soon. Okay.
Thanks.
No problem. Bye.